In this demonstration I would like to show you how you can do a plaque analysis on a CTA dataset using our QAngioCT application. What you see in the screen is already a coronary tree extracted. This was already done. It takes about 50 seconds in this case. And we can take a look here and inspect different vessels. So for instance here we have the LAD. It's automatically labeled and sub-labeled. We could select another vessel by for instance the RCA by clicking on it, and then we can see over here on the left the vessel and inspect it. We can do a synchronized viewing. So for instance we can synchronize position and orientation so that when I view, everything is synchronized with each other. So I'm going to do a demonstration of the LAD, and I select the vessel and click on this plus sign to add a segmentation of a vessel, and I can just type here LAD to give it a label. And here we have the center line extracted. You have to make sure that there's no contrast in the center of the image. If so, you refine. Typically you do this once or twice, and you can see that the calcium is pushed back to the side of the vessel. So this is fine, and then we go to the next step to do a contour detection of the lumen, where we can now inspect the lumen detection in the short axis viewport or in the longitudinal viewport. We can also rotate to see if the segmentation did a good job. And we can also do the outer vessel, so I can clear on the vessel contour to detect that automatically. And now we can also see here how that looks like. So let's say this is fine. We can go to the next step. We go into the segments, and here we can click the auto button to get rid of the ostiole, the distal part below a certain set diameter, and create all the labels for the different segments. So you can see here left main, proximal LAD, mid LAD, and also here you can now start already to select segments on the right upper corner and inspect some QCA like parameters to get for instance plaque volume, or we can also get mean plaque burden, for instance. In case you want to measure a lesion, you can put the marker on the location where you would like to put it. I can zoom in, and I can go here to this lesion tool and just add a lesion at this marker, and then we get all kinds of QCA like parameters, also on the obstruction, so area, diameter, stenosis, plaque volume of this lesion. You can also modify these markers, the proximal or the start and end point of the segments, or the proximal distal parts, and the obstruction. If you're interested in looking at the plaque, it's already quantified. So we have here all kinds of values, and we can visualize that as well by going to plaque characterization and showing it in the viewer and in the diagram. So here you have a nice overview of this lesion. We have different models. We have a fixed model that makes use of thresholds to quantify types of plaque. It's also possible to use the adaptive approach, so that takes into account also the intensity in the lumen that lowers when that attenuates going from proximal to distal. If I update, so let's say we have done the LAD, we also have the segmental values, and we would like to do another vessel. Go back to the tree on the left upper corner, and maybe we want to do the RCA, so I select the RCA, and we go through the same process. Click on the plus to add a vessel, maybe give it a name, check the center line, refine it, Then we go here, we see the calcium is outside, that's good. Go to the contours, and we can do the vessel here as well. And so you can create segmentations for all the different vessels as you wish. So let's say you've done the analysis on a complete patient cohort, maybe 100 cases or even more, and you would like to now batch process all the results that were generated with the QNGCT application. So in here we have all these different segmentations. You can already quickly review them, and I can check everything and go to our report wizard on the left upper corner. And here we can scan for all the results. It's quite flexible what type of parameters you would like to create in the report. For instance, for a vessel or a segment, I can select all the different parameters and add them to the report and just scan again, so that everything will go into this table. And to export this table, I'll click that I want to open it when it's finished. I will save in Excel. And here you go. You have all the results of all the different patients from your folder, and for every line we have a patient, a segment, and a lot of different parameters as selected. So this will allow you to efficiently post-process a vast amount of data from the QNGCT analysis.